Every strand of hair begins a journey, a cycle of growth, rest, and renewal. But what happens when this journey is disrupted? For millions around the globe, hair loss is not just a medical condition, it's a deeply personal battle. Today, we embark on an odyssey through the science, the art, and the breakthroughs in hair loss treatments. Dermatologists, residents, and experts, welcome to the frontier of trichology. The hair growth cycle, anagen, the building phase. The follicle is alive with activity. Matrix cells divide rapidly, elongating the hair shaft. Duration 2 to 7 years. Catagen, the transition. The follicle begins to shrink, the workers packing up. Duration 2 to 3 weeks. Telogen, the resting phase. The strand detaches but waits for its replacement. Duration 2 to 3 months. Structure of the follicle. Dermal papilla, the nerve center rich in signals for growth. Outer root sheath, the fortress protecting the follicle. Sebaceous gland, the oil producer. Its overactivity creates chaos in conditions like seborrheic dermatitis. Non-scarring alopecia battles that can be won. Androgenetic alopecia, AGA, the silent invader. Pathophysiology, DHT, shortens the growth phase. Miniaturizing hair follicles. Clinical features, men, bitemporal recession, vertex balding. Women, diffuse thinning, sparing the frontal hairline. Diagnosis. Trichoscopy reveals miniaturized hairs alongside normal ones. Telogen effluvium, TE, the great shed. Triggers, stress, illness, postpartum changes. Diagnosis, positive hair pull test. Diffuse thinning with normal scalp appearance. Alopecia areata, AA, the autoimmune ambush. Variants, ophiasis, serpentine pattern along scalp margins. Totalis, complete scalp loss. Universalis, total body hair loss. Diagnosis, scalp biopsy, parabulbar lymphocytic infiltration, trichoscopy, exclamation mark hairs. Scarring alopecia, the unforgiving foe. Central centrifugal cicatricial alopecia, CCA, the silent erosion. Clinical features, central thinning spreading outward. Scalp tenderness and scaling. Lichen planopilaris, LPP, the inflammatory assault. Clinical features, follicular keratotic plugs, perifollicular scaling. History taking onset, progression, patterns, triggers, family history of alopecia or systemic illnesses, physical examination, scalp inspection for inflammation, scaling or scarring, hair pull test, tugging gently reveals excessive telogen hairs, diagnostic tools, trichoscopy, findings, yellow dots, miniaturized hairs, blood tests, iron studies, TSH, ANA, vitamin D levels, scalp biopsy, essential for distinguishing scarring from non-scarring alopecia. Androgenetic alopecia, defying the miniaturization. Topical minoxidil, the growth stimulator. Twice daily application prolongs the anagen phase. Oral finasteride or dutasteride, the DHT blockers. Systemically reduces DHT levels to protect follicles. Advanced therapies, PRP, platelet-rich plasma growth factors injected to rejuvenate follicles. Low-level laser therapy stimulates follicular metabolism. Telogen effluvium, reversing the storm. Address underlying causes like stress and nutrition. Iron supplementation for ferritin less than 30 nanograms per milliliter. Alopecia areata, outsmarting the immune system. Mild cases, intralesional corticosteroids, triamcinolone. Severe cases, JAK inhibitors, tofacitinib, a game-changer in restoring hair. Scarring alopecia, the final frontier. Anti-inflammatory agents, doxycycline and hydroxychloroquine. Surgical solutions, hair transplantation in stable cases. Stem cell therapy, rebuilding follicles from scratch. Gene editing, CRISPR, targeting the very roots of genetic predisposition. Advanced prosthetics, hyper-realistic hair systems. Hair loss isn't just a condition, it's a story of resilience, science, and hope. Together we heal not just scalps but spirits. Let's continue this journey, transforming lives one follicle at a time.